Hello everyone, come back with me. I am Maria Afrasya Nurhayati. I am a student in semester 1 of 2020D nursing class. In this video, I will discuss explaining medications. Number 1, I will read the text about educating patients about their medications, the potential and limitation of written drugs information. Number 2, I will explaining the material about imperative sentence. And number 3, I will example to positive and negative imperative sentence. Okay, now I will read the text. Educating patients about their medications, the potential and limitations of written drug information. Drug information on labels and insert is a major source of knowledge for patients as they attempt to balance the risks and benefits of drugs and administer them safely. Yet this information is often inconsistent, incomplete, and difficult for patients to read and understand. We argue with the numerous sources of written prescribed drugs information, the regulations that govern their content and format, and the lack of oversight in the process, and the history that led to this system. We suggest to oversight and standards are needed so that written drugs information can serve as a current and organized system to educate patients. To make thoughtful decisions about using medications and to take them safely and appropriately. A patient must have at least a basic understanding about the risks and benefits of their prescribed drug and how to administer them. Recent safety problems associated with commonly prescribed and aggressively advertised medications such as the COX-2 inhibitor and antidepressants have increased awareness about the importance of considering medication risks. In its 2006 report, Preventing Medications Errors, the Institute of Medicines, or AOM, highlighted the pervasive problem of poor medication safety. Ideal patients should receive counseling about risks, benefits, and safe administration of medication from their physicians and paramedics. Surveys indicate that most patients prefer to receive this information from the physicians as learned intermediaries. However, that inconsiderable evidence that as discussion scores intricately and are often acute limited. A recent study evaluated audio to bed of visit and found major faults in the quality of information communicated to patients about their prescribed medicines. Physicians explaining adverse effects and duration of therapy in only about a third of the discussions and provided patients with instructions for use in only 55% of the discussions. Communications with paramedics is also inadequate. As a result, many patients rely on written information, either or labels or in the text insert. Short of written prescription, drug information, container labels, and CMI leaflets. Patients have a several source of written information about prescription drugs. The container label provides basic drugs information such as the drug name, dose, instruction, pharmacy, and patient's name. The container also sometimes editions actually staggered to communicate editions, warnings, and administration directions. Supplementary leaflets of the accompany prescribed filler referred to as consumer medications information or CMI. These have more short art than the container label are used to communicate additional information about medication, direction, risks, and benefits. Package insert. Some drugs are dispensed with a package insert, a document approved by the Food and Drug Administration of if the that contains scientific information about pharmacokinetics, pharmacodynamics, muscular structure, indications, risks, and benefits. Despite the recent information change to simply readability, this document uses technical language aimed at physicians but is frequently delivered to patients via single dose contrast paid by the manufacturer. Number 2, I will explaining about imperative sentence. Imperative sentence is used to give instructions. There are two kinds of imperative sentence: positive imperative and negative imperative. Positive imperative used for giving positive instructions, but were at the beginning of sentence. Precede the sentence with place to make polite introduction, and for example, 1. Please take medicines. 2. Please take care of the patients. 3. Wash your hand before eating. 4. Please clean the patient first. 5. Please tidy up the room. 6. Please contact the Dr. Santi. 7. Please wait in my room. 8. After going to the hospital. 9. Please give medicine of him. 10. Please be patient for a moment. Now I will negative imperative sentence. Negative imperative used for negative instructions. Put the word don't at the beginning of sentence. And for examples, take medicines regularly. Do not consume a lot of salt. Do not open your eyes. Do not drink alcoholic beverages. Do not go to the Dr. Ronald's clinic now. Do not wait in my room. Thank you.